Hi everyone, my name is Hannah and this video is for exercise instruction. It is a detailed description of the proper form for performing a squat as well as including modifications for progression and regression of the exercise. The first thing to note when performing any exercise is that if you feel any discomfort or even a twinge of pain, you need to stop the exercise immediately. It's not for you. To begin the exercise, you're going to start with your toes either straight forward or at a slightly tilted out angle to follow the line of your knees. Your feet are going to be approximately shoulder width apart, and you're going to remember to keep the spine, neck, and the pelvis in a secure neutral position to help prevent against back injury, especially lower back injury, which is very common in exercises. You're going to begin by, I'll show you from this angle, you're going to begin by bending the knees and pressing the tailbone and the middle third of your body posteriorly as you squat. So you're going to remember to keep the torso nice and erect, chest nice and lifted, and the head in line with the rest of the body. Also remember to keep the thigh nice and parallel to the ground. You're not going to squat way low below your knees. You're going to keep a 90-degree angle. And the knees are meant to be behind the toes to avoid hyperextension. So as you go up in the exercise, you're going to take one hand, place it on the thigh, and the other hand out as a counterbalance. You're going to exhale on your way up. And remember, when you are going back to your starting position, you're going to fully extend the knees, remembering to avoid hyperextension, and you're also going to fully extend the hips, and a slight pelvic, posterior pelvic twist, tilt is okay. Now, if you're like many people and a simple bodyweight squat seems a little too easy, or you're not getting enough strain or intensity out of the exercise, you may be looking for a modification or a progression. In this case, you would want to either increase your repetitions of the exercise or add a weight and increase the overload. So in this case, I am not in the gym, I'm in my apartment, so I have no dumbbells, I have a pumpkin. You're gonna hold the dumbbell in front of you, keeping it as close to the midline of their body as possible to avoid either pulling yourself forward and you're leaning too much on your toes, going to destabilize you, or tilting yourself backwards and putting excess strain on your spine. You're going to keep it closest to the center of gravity as you can, again with those feet shoulder width apart, toes slightly tilted outwards, torso upwards, nice and lifted. You're going to squat all the way down to a 90-degree angle, holding that dumbbell in front of you, and you're going to press up, exhaling as you extend. Remembering also to extend the knees fully and fully extend the hips again. Now, on the other hand, if you are either post-injury or you have some weakness or destabilization in your knees or hip joints, then you may need to modify the exercise in the other direction. You may need a regression. So in this case, you could either do all the same steps with your feet shoulder width apart, torso erect, chest lifted, head in line, spine secure, and going into bending the knees. You can place both hands towards the end of the knees and use both as a support to push your body back upwards. Or if you need something else, you could use a table or a bar in a workout room to help stabilize yourself downward. You may not get all the way down, but anything is helpful, and use it to stabilize yourself on the way up. Obviously only using body weight, and that would help to modify the exercise in a regression to compensate for weakness or post-injury.